So this is just a quick video on the fitness assessment process itself, the types of tests, and looking at health-related versus sport performance aspect, and just look at what we're trying to do with the assessment process. So when we look at the types of fitness, there's skill-related, which is more sport and performance, so your SAQ, your speed, agility, quickness, coordination, balance, and power. And then we have our health-related over here, which is cardiovascular, muscular strength, and these 5 domains of fitness is what we're going to be focusing on for this class, and probably the most popular within the fitness industry. If you end up working with athletes, you would be incorporating the skill-related. But in terms of your sedentary individuals, people looking to make lifestyle changes, your aesthetics, this is the end of the spectrum we're going to be at. The skill-related, these are agility, balance, coordination, and you can read through here, but not that these aren't good things, but a lot of these things are things that can't be trained in the first place. Like agility is a learned, balance is kind of learned, speed, all these aspects come from musculoskeletal performance. And so when you're training for that, you're already doing that through the health-related components. So this is what we'll be on, is the cardiorespiratory, muscular strength, endurance, flexibility, and body composition. So the cardiorespiratory aspect is how effective is your cardiovascular system delivering blood to the working muscles. Muscle strength is looking at force output. Endurance is the repetitive ability to maintain that. So not endurance in terms of how long you can run, but how long can your back or your core support the standing and twisting activity that you're doing. Flexibility is not so much how much can you lengthen your muscles, like how much can you touch your toes, but it's looking at the appropriate joint mobility. This is by far becoming the fastest growing and most diverse in terms of assessment aspects. It's grown beyond its sit and reach aspect, and looking at this whole kinetic chain, the tissue, the neurological, the motor control, that's looking at joint availability and resources. And not looking at just mobility, but also stability. And then we can't get away from it, the aesthetics, the body composition, and not so much of just weight loss, which is a horrible word, but true fat loss, where you're reducing body fat, adipose tissue, which is an indication of decreased inflammation. When you look at the goals you're setting with your clients, there's going to be health goals, right, to prevent absence of disease or disease states. Fitness goals, looking at higher levels of functioning, right, which is becoming more and more aspect of pain-free living and quality of life versus quantity of life. And then performance goals, looking to achieve desired levels within sports or competition. Health goals are these aspects here of like things that would lead to disease. So like this is fundamental, and this is kind of all the medical industry really cares about right now, is your cholesterol level, blood pressure, body fat. And as long as these numbers aren't out of whack, then you're fine. We're not going to see you, right? There is a division of functional medicine now that's looking at wellness instead of just health. Remember, in the definition of health, these were things that were more passive, things you could not pick. But remember the genetics aspect, about 24% come from genetics, and 76% are from lifestyle habits. And the ACSM, American Heart Association recommendations for physical activity, but as we know now, that physical activity is not what's going to elicit the changes and increase your tolerance, but it's going to be the vigorous exercise, so the exercise itself, not physical activity. Looking at functional capacity, muscular strength, and flexibility for your physical fitness goals. The more strength you have, the more stability you're going to have, the more flexibility you're going to have. The more strength, the more muscular performance you have, the more you're going to be able to endure before you have breakdown. The more muscle you have, the higher metabolic output you're going to have, the faster your body's going to be able to crank out white blood cells for immunity, right? So all these things trickle down from it's not the process of working out per se or the outcomes. It's not the more muscle mass. It's the process that you use to achieve that muscle mass. That's what I'm trying to say. For the achieving fitness goals, the same elements for the health goals. It's a combined balance of programming that hits these higher exercise intensities. And this is basically what I've been saying the whole time, is that physical activity is not enough. Physical activity is using the resources that you have. So when you've hit your pinnacle of your performance and you're at the level that you need to, fine, you can do some physical activity, go for a walk. That's all you need to maintain. But maintenance isn't what we need if we need to change, right? We need to change. So we don't want to maintain the status quo. We want to shake that up and get that out of there. Performance goals come in later, but performance can be looked at in terms of not just sport, but this ability to like play with grandchildren or do things independently. I mean, I look at it from a physical therapy perspective. Some performance goals, if you have a client or patient that doesn't want to use an assisted device anymore, they want enough stability that they don't have to use a cane or a walker. There's a lot of words here on this slide, and I do want to bring your attention down to this aspect here, is that sport does not equal fitness or health. And sport is borderline annihilation. It's not stimulation, it's annihilation. And sport isn't necessarily ideal for the body. You are using the body in its extreme aspect to maximize output, sometimes at the expense of tissues. So you would never say, hey, I want better shoulders, so I want to go be a pitcher, or I want good knees, so I want to play football, or I want, any, you just input anything there and you will see that sport is not. And bodybuilding is a sport. Distance running is a sport, and all of these aspects become goals or baselines for people's fitness programming. And we'll talk about bodybuilding throughout our muscular skeletal aspect, but running too, it's about your body has to be ready to handle those loads. Running, Olympic lifting, bodybuilding, sport, these are all at the high end of stimuli and are borderline past stimulation and into annihilation. So just something to think about with your when you're looking at where you're getting your resources from. I wouldn't follow bodybuilding athletic unless you are training a bodybuilder, unless you're training an athlete, unless you're training a distance runner. It wouldn't take a sedentary individual and mimic exercise protocols for those individuals.